Today is April 15th, Wednesday, 10 a.m. I'm Dan Spencer from the Bellingham Board of Selectmen, here to give you the most updated and accurate information regarding the coronavirus with regards to its effect on the town of Bellingham as well as its residents. As per usual, we will start off with our Deputy Chief, Mark Boria.
Okay, thank you very much for joining us today. So we'll start off with some numbers, the Massachusetts numbers. We have 28,163 cases. We have 957 deaths with a new number that I came up with today, 126,551 tested. So we're out there testing a lot right now. US numbers, 614,246 cases and 26,064 deaths, with 38,820 recovered. So that's a good number also. Thank you.
All right. Next is our public health nurse, Esther.
Good morning. So as of this morning, we have 35 active cases. Excuse me, we had 35 confirmed cases in Bellingham. We have 15 recovered to date, and we have had a total of 159 tested in Bellingham.
So just kind of piggybacking on Deputy Chief's comment about the increased testing. So increased testing is most likely going to show increased positives. So we're probably going to see numbers that are a little bit bigger than we've been getting. It's probably nothing to get overly alarmed about unless that number is a huge spike, but we can almost certainly expect to see some increases, correct?
Yes, definitely. As the testing gets better and gets faster, more people are going to be tested. And you have to remember that it's not known how long it takes to clear the virus. So just because you test positive today doesn't mean that you just got sick with the virus. It just means that you have the virus within you. So it's really going to jump up once the testing becomes more rapidly available.
All right, and that's kind of the point I want to make is sometimes people are watching the news and they just see the number of positive cases and they're not really thinking about, well, what are some attributions to that number spiking. So just kind of make sure people are aware. Increased testing is going to show increased positives. It's just the ratio. So, all right, Bruce, Board of Health. It is.
Good morning, everybody. Numbers are still climbing slightly, but a lot of it's going to be because of the testing. Nothing outrageous. I think we're still climbing the small plateau to get to our plateau there. Expect to see that probably by the end of the week or maybe middle part of next week. Remind everybody to take your social distancing seriously. That's how things are being spread. Wash your hands. If you've got to go out and get just what your necessities. Try to stay put. Let's see if we can get ahead of this. If you go to the store, designate one person to go with the list. Don't bring your whole family. Don't subject your little kids or grandma, the public out there. The stores still have quite a few people, and it's difficult to maintain all the social distancing there. They're doing their best they can. They've got lines on the floor. They've got lines at the registers. The people regulating and telling you when to come to the register. So it's important that you pay attention to those guidelines that they're doing. When you leave the store, the personal protective gear you wear, and make sure that you dispose of it properly. Please don't throw it on the ground because now somebody has to pick it up, considered hazardous. We have a vendor that should be shortly opening up a little tent to sell personal protective gear. So look for that. It'd be at the Trump store on South Main Street. We're hoping maybe get him open by the end of the week or the early part of next week. You'll be able to buy your masks and gloves there. It's actually a pretty reasonable price. So those who want to get some, I know that I've received several calls and I've been unsure where to get it now. Now we have a vendor here in town locally.
All right. Just kind of piggybacking on and talking about the social distancing. I heard an interview this morning with a medical professional, and they were saying, and correct me if I'm wrong, but the federal government, or the federally nationwide, they were expecting at the peak to be between like 1.5 and 2 million positive cases. And the fact that we're sitting at 614,000 is attributed to the point there that those numbers were modeled on 50% of the people complying to social distancing guidelines. And it appears as though that there's been a much larger percentage of folks in the country doing the proper social distancing, doing the right things, that is keeping that number down from where the model was projected. So that's a positive thing, that people are doing the right thing, heeding the CDC warnings, and continue their social distancing, maintaining sanitizing stuff and washing their hands. So that's a good thing.
I've seen it. I mean, I'm out doing inspections all the time, checking out the stores, stuff like that. And for the most part, people are pretty good about it. And a lot of the stores are sensitive to it, with letting only a certain number into the store. A lot of the stores have, I don't know if people pay attention to it, but they have a second story, and the manager can look out and see what's going on all around the store at any one particular time. So I know the guy from Market Basket is able to have a close idea of where any of the bottlenecks are, and he can send personnel there to break it up.
Yeah, and then, like I said, my point is that people are cooperating, and it's we're getting much better results than we had earlier anticipated. So keep up the good work as far as that goes. Anything else, Bruce?
I mean,
all right.
Things are steadily continuing. The inspectional services and Board of Health are still open for business. Obviously, the town hall is closed, but you're able to drop your applications off at the door, or we're now up on online permitting in both departments. So, the construction trade has been full steam ahead.
All right, great. So, as we're asking, if you guys have any comments, questions, or concerns, excuse me, please email it at covid19@bellinghamma.org. And Dennis, overnight we received a few more questions.
We did receive a few questions, several for Esther. We have noticed that grocery stores and hardware store employees are not wearing masks or gloves. Why is it not mandatory for them? Or is it mandatory for them?
My understanding is that it is a suggestion to wear a mask. My best guess, honestly, is that they just don't have them. That's why they're not wearing them. In regards to the gloves, it's actually better if they don't wear gloves and use hand sanitizer between each customer. Because think about it, if you're wearing the same pair of gloves, you're touching everything that everyone's putting on the belt. You're not changing them between customers. So honestly, it's probably a good thing that they're not wearing gloves. I do know that in the state of Rhode Island, they have just passed an order that all employees in essential businesses do need to wear masks. I'm not sure if an order like that is coming for us. As of this time, it's just an advisory.
On the data shared, I do not see the number of deaths attributed to COVID-19. I know this is a very private situation, so I believe that is why it's not included. I just wanted to confirm. So someone was curious about the number of deaths and why we haven't reported that evidently here in Bellingham.
Part of the reason is because honestly, we haven't had any up until yesterday. We did get our first confirmed death, but we just didn't have any in town to report.
And that is some sad news. We did in fact,
it is.
Receive notice that our first death for a Bellingham resident. What is the main reason? I think we touched on it, but I'll ask it. What is the main reason for the increase in the number of cases? Is there any correlation in the tracing caught at work, when shopping, or family contact? I think the family contact is a big one, because we talked before, maybe you can touch on it, the fact that a lot of the people that are testing positive are in professions that really lead them to being exposed to the virus.
Yeah, I've definitely seen that trend here in town. There are a lot of healthcare workers or people that work in the essential businesses that are testing positive. Surprisingly, they're doing really well with isolating when they have symptoms, and their families are not testing positive for the most part. The numbers, as we said, are going to increase as the testing becomes more readily available. And now that grocery store workers and I believe other essential retail workers are considered part of the essential list to be tested faster, we're going to see those numbers come up as well because they have more access to the testing.
Great. We live very close to the Rhode Island border, and a lot of things we do are in Rhode Island. Heard that if we pass into Rhode Island to go to the bank or a quick errand, we'll be told to self-quarantine for 14 days or get arrested. Is that true?
That is not true. If you are relocating into Rhode Island, if you have a summer home, if you're vacationing and you're going to be staying in Rhode Island for an extended period of time, then you are asked to quarantine for the 2 weeks, but you can go to Rhode Island for essential services like the bank and the pharmacy without having to quarantine.
Are the Goodwill collection boxes accepting washed clothing donations during this time, or should these items be saved until normal business resumes? I don't know if that's one for you or not, or if you have any knowledge on that one.
So at this time, it's still not known if the virus is staying on fabrics. I have seen some of the donation boxes overfilled. I would suggest just hanging on to them, wash them, put them in a plastic bag, and then when things start to reopen, we can go ahead and get those donations rolling again.
Thank you, Esther.
You're welcome.
Had a couple other items if you'd like
Yes,
to touch on. Speaking of clothing, we have that program where if you have clothes and you'd like to have them picked up at the curb, you can put them in the pink bags. That service has temporarily been discontinued. The drivers are not collecting right now, so you may have to set those clothes aside as well. So those pink bags are not being accepted. And trash, we had a little blip yesterday with power outage for a lot of people. So I know there's probably a lot of the curbside today from those homes that were without power yesterday. A lot of them were in the Wednesday collection area, and we did ask the hauler to be sympathetic to the fact that people will be putting out, maybe cleaning out their freezer or their refrigerator if they lost power for the day. So we'll try and work with people on that. And again, the trash collection is available Tuesday, Wednesday, and Thursday at the recycling center. We've had a lot of questions. It's for yard waste only. Tuesday, Wednesday, Thursday, 9 to 2. We've had a lot of questions about opening it up on the weekends, and we will be looking at that, not this weekend, possibly next weekend.
Dennis, could, on the closed donations, there are a number of bins by Larry's Liquor Store. They are accepting clothes, but if people come there and the bins are full, please don't leave them out in the parking lot. There's a number on the bin to call if the bins are full, or call one of us at the town hall here, and we'll call the company and say, your bins need to be emptied. But please don't put your bags out onto the ground on there, because it creates a trash situation where it gets loose or it gets blown, it gets all wet or whatever. But I know that the bins at Larry's are still accepting clothes.
Thanks, Bruce.
All right. Anyone else in studio? Larry, Beth, all good to go? All right, so again, I just want to reiterate that the purpose of these updates is to provide you with the most recent and accurate information, accurate being the key. I know a lot of us like to depend on social media to get our news. A lot of times that you've got to take that in context. And if there is something you see on social media that you have a question or concern of, please contact us. Again, COVID-19 at bellinghamma.org, and we will get you the accurate information with regard to that. Other than that, everyone stay healthy, continue maintaining social distancing.
I think we had one announcement.
And Mark's going to make his announcement.
And we'll just reiterate again that any COVID-19 questions for Massachusetts, you can dial 211. And in the event you have an issue at work and you want to ask the Attorney General a question, it's 617-727-3465. And that's for the Massachusetts Attorney General.
Great. So yeah, tomorrow we're going to have a couple of individuals in studio here. We're going to have the frontline first responders. We're gonna have a representative from our fire department and a representative from our police department. So they're gonna kind of come in and give you a bird's eye view of what their days are like and what their concerns are when they're responding. So please tune in for that. Everyone, stay healthy. Thank you.
Thank you.
Thanks.